Hi, I'm here to talk to you today about something that's really important to me, and I hope you appreciate what I have to say and consider it as you move forward in your careers. Did you know that 1 in 10 women and people who can become pregnant have a disability? You may think of disabled people as unable or uninterested in having children. However, the People First movement in disability justice and human rights, with its acknowledgement of the full spectrum of people who experience disabilities, is helping to break down this stigma. As future healthcare professionals, you have both an ethical obligation to give the best care possible to all of your patients and to recognize the places where you may not be aware of the struggles that your patients face. Or perhaps you too are living with a hidden disability, as I am. I was born with congenital oral atresia, a condition where one of my ears did not fully form internally. Most people who meet me never realize because I had reconstructive surgery on my outer ear as a small child. I do not have a speech impairment and I can read lips really well. This disability affects my ability to hear and comprehend the conversations around me, and I now use closed captions when listening to video recordings or watching movies. I qualify for the use of a hearing aid, although I find it cumbersome and I prefer not to wear it whenever possible. While my disability is seemingly minor, it affects every interpersonal interaction I have, and it's sometimes misinterpreted as rudeness or a lack of understanding. You can imagine in healthcare how that shows up when I ask someone to repeat themselves and they say something different than they originally said, and I have to ask them to explain it again. At that point, they often think that I just can't comprehend the information when really it's I can't hear the actual words they're saying. And like I said, you would never know that this ear had surgery when I was a small child and looked much different when I was born. According to the CDC, a disability is any condition of the body or the mind, an impairment, that makes it more difficult for persons with a condition to do certain activities, activity limitation, and interact with the world around them, participation restrictions. Examples of disabilities could seem really obvious, like a leg amputation due to diabetes, or a baby born with congenital blindness. I'm sure you've learned about and maybe even seen some of these things in your work as a student doctor. But disabilities can include things like low vision, or less commonly understood and validated, like disabilities that affect cognitive function, mental health, social relationships, or are internal and or progressive, like multiple sclerosis. So when you meet someone, it's really important never to assume that you understand what's going on with them. And in disability justice, a person may feel that their disability is not actually a hindrance. The hindrance comes from the inability of the society and the people around them to respect and adapt to their needs. So, because many disabled people have conditions that don't affect their fertility, disabled people can become pregnant and birth children. Many disabled adults live full and engaged lives and desire to have a family, which is their human right. You must understand what legal responsibilities you have in caring for them. For example, the Americans with Disabilities Act, or the ADA, was passed in 1990, and it's a federal law that requires reasonable accommodations such as wheelchair access, access to an interpreter, and reasonable changes to policies and practices to meet disabled people's needs upon request. In the birth space, you may need to get creative with how you offer support and make sure a person has access to assistive technologies and personnel that they need. For example, a deaf person must have access to a qualified medical interpreter that understands healthcare, not just the interpretive skills of a family member or a friend. You may need to be aware of certain health conditions that may be more common for a disabled person, such as bed sores in someone that is unable to stand and needs to be in a wheelchair or in a bed the majority of the time. However, but you should never assume that their disability means that they will necessarily encounter a disease or a problem. Many disabled people learn to care for themselves very well and are great advocates for their own health care. Always listen to your patient's needs, concerns, and feedback to you, and celebrate their normal and positive experiences as pregnant people. Lastly, never assume that someone is incapable of making their own decisions in healthcare due to their disability, even if they have some cognitive impairment that may require you to change how you approach healthcare conversations with them. An example of that could be a person who has Down syndrome. Include them as a full participant in their care to improve their quality of life and their pregnancy outcomes. We know that disabled people are more at risk of having issues show up in their pregnancy that affect their outcomes, and so having a clear and thorough conversation can mitigate that. As we move forward as a global healthcare workforce, we have a better understanding of how human rights issues affect us all as patients and providers. People with disabilities are no different. I encourage you to seek out education, training, and feedback from your mentors and your patients as you learn how to best care and advocate for our community. Historically, as you probably know, medicine has not advocated for the needs of disabled people and has frequently harmed us. But you have the power to change that, and I know that you can.